Okay, hello everybody. Hopefully you can hear me. This is Ben Wheeler. I'm going to be hosting and chairing this webinar today. We may just have a few more people arriving as the things get started. Hopefully you can hear me and also see Becca's slides. I'm getting a message that this is sounding very echoey, so I'm going to try and not speak from my end too much. We'll see how we go. So it's just after 1 o'clock, so I think we'll get started. We may still have a few more people arrive, but we'll just crack on, I think. So without further ado, I'll hand over to Becca.
Hi, thank you very much, Ben. So today, thank you very much for joining us for this webinar. Today's webinar is going to be focusing on investments in the environment, specifically for health outcomes. And I'm going to whiz through what the evidence tells us at the moment. Has that slide changed for you? Yeah. So I'm going to whiz through the evidence, and I do want to say that this is has a UK focus, because a lot of the work that we've based this on relates to that context, and also that we've tried to devise this webinar for people who aren't experts in the evidence, so people who might want to know more about what the evidence tells us, but aren't dealing with it on a daily basis. The webinar is part of our project called Informing Environmental Investment for Health and Wellbeing, which is funded through the Southwest Partnership for Environmental and Economic Prosperity, the SWEEP project, which is NERC-funded collaborative initiative to help deliver economic and community benefits across the Southwest. And we have links to it on the website, which you can read a bit more about on there. So today, I've decided to talk about environmental investment for health outcomes, and I've posed a number of questions throughout the presentation, which I'll attempt to answer, and I thought these were kind of questions which people might be interested in. So I'll be talking a bit about how we do and can invest in nature for health, what we know about whether investing in nature benefits health, whether investing in nature benefits health, so how it does it, whose health benefits from investment in nature, whether investing in nature is cost effective, and then about how we can take an evidence-based approach to investing in nature for health outcomes. And then at the end, I'll just have a quick conclusions, then we'll have about 20-25 minutes for questions. So the presentation is based on a set of reports that we've been writing, predominantly for government departments, from DEFRA to Natural England to PHE and others, around the links between natural environments and health, and how we can invest or intervene in environments to enhance those benefits. And these have been conducted over the last couple of years, and some of them are already available on the website, and others will be coming soon. But the ones I'm predominantly talking about are the results of some work which Ben was involved in for the World Health Organization, the two green ones in the bottom corner, around reviews of evidence on what happens when you intervene in green spaces for health, but also this one here, which we have just completed and which will hopefully be published soon, which is a rapid scoping review on the links between health and wellbeing and green infrastructure specifically, and this was to inform the new green infrastructure standards for England, and this will hopefully be published very soon. So the first thing I want to say is just a bit of context on what it is that I'm talking about today. So the first point is around what is health, and we wrote a little document on demystifying this concept of health, which I'll link to in the package of stuff which we'll put up at the end of the talk. But the thing I want to state is that health is not a monolithic thing. It is a complex adaptive system, and it's a dynamic state, so it shifts and changes. It's not fixed or absolute. And health is constantly responding to environmental, social, biological, emotional conditions or states. And we think of the environment as something which both determines health, but also is a resource or an asset through which we can improve or promote or protect people's health and well-being. And this leads me to the second question, is how therefore can we invest in nature and the natural environment for health? So what is this idea of investing in nature for health? And here there are a great range of different things that we can do. And these range from providing new spaces, so creating new green spaces and natural environments, improving the spaces that we already have. It may also be through increasing the sort of infrastructure or the characteristics of those spaces, so increasing accessibility and usability of spaces. It may also be what we might think of more as social activities, so encouraging use of and exposure to spaces for health benefit. But it also may be through the indirect pathways to enhancing the wider ecosystem services. I do want to say that the majority of our evidence relates to urban green spaces and discrete pieces of green space for particular types of health outcomes, such as mental health or encouraging physical activity. So what I'm going to talk about predominantly relates to these kind of pathways, and that's solely due to the weight of evidence that we have. I will talk about ecosystem services and other types of investment in nature where I can do, but this is where the majority of evidence has been, or this is what the majority of evidence relates to. So my first question is, do we know if investing in nature benefits health? We've been working in this area for about 10-15 years of substantively trying to understand the links between environments and health, and therefore the ways in which we can use environments to promote and protect people's health and well-being. And we've got to the stage where we now have a relatively substantive body of evidence which we can bring together through quite formal processes of evidence synthesis to look at the trends across and within bodies of evidence. So Ruth Hunter and colleagues, of which Ben was one, recently produced a fairly large-scale formal systematic review of what we know about intervening in nature for health outcomes. And what this review concluded is that there's now strong evidence that making physical changes to and or improvements to green spaces and natural environments alongside, and importantly alongside, social promotional actions are effective in promoting health. So what this is saying is that we can improve the environment, but if we want to also improve health through those actions, we also need to run these programs of social promotional actions. So, showing people where these spaces are, the kind of things that they can do in these environments and so on. These are the actions which relate to health. Studies or the interventions which didn't have these social promotional actions were less likely to result in health gains. They also found consistent evidence that new greenways and trails, so pathways with street trees and so on, alongside, again, as with the creation of new spaces or improvement of spaces, of these social promotional actions are also effective in promoting health. And there's a small body of evidence that suggests that broader greening of the urban environments is effective in promoting health outcomes. We also have a relatively small body of evidence which suggests that trying to promote ecosystem services and enhance ecosystem actions is effective in promoting health. The majority of evidence relates to the function of the ecosystem actions themselves. So here about reducing flooding through SUDs, reduction of heat islands, and so on. We have relatively little evidence of direct impacts to health. However, the pathways between improving the ecosystem function and health outcomes are plausible. And I think this is a case of where we have an absence of evidence rather than an absence of effect. This body of evidence has now led to organisations such as WHO producing reviews, such as that Ben was involved in, and these statements of where we are with the evidence, suggesting that investing in nature and interventions in nature can be effective. So here they have this statement at the end of the review on the evidence for interventions in nature and health outcomes. They suggest that interventions to increase or improve urban green space can deliver positive health, social and environmental outcomes for all population groups, but particularly amongst lower socioeconomic status groups. And they go on to say that there are very few, if any, other public health interventions that can achieve all of this, and especially the impact on active lifestyles, mental well-being and social interaction. So what they're saying here is that intervention in the environment can have significant impacts to a number of different health and well-being outcomes. So my second question is, how does investing in nature benefit health? So what happens when you invest in the environment for health? And here it's quite complex. There are multiple levels of sort of actions and things which are happening. So depending on the type of investment in nature, You may see direct benefits at an individual community or a therapeutic level, so people's health may improve as a result of the investment in nature. There's a second level to this. Investments in nature may also have an impact at sort of a neighbourhood level, so health and well-being and quality of life may be affected at that neighbourhood level. But also those are two nested within ecosystem level impacts, so the indirect pathways to health outcomes. So the example I quite often use here are domestic gardens. So domestic gardens, so people who have domestic gardens, they benefit, or some benefit directly through the act of gardening, of looking after their garden, so physical activity, being outdoors and so on. It has that primary direct impact to their health. The act of looking after your garden, of having a nice tidy garden with flowers and trees and so on, has an effect at a neighbourhood level. So we know that there's a strong correlation between the quality of the environment in a neighbourhood and health outcomes. But then the gardens also contribute to ecosystem services at that global but also local scale. So can contribute to the reduction of flooding, improvement in air quality and so on. So here we can see that there are multiple nested ways in which interventions or the provisions of new and different types of environments relate to health and well-being. And this nested nature means it's difficult to unpick how interventions or investments in nature influence health. However, we do have bodies of evidence which again have been summarised through these systematic reviews, which I'll link to at the end, which do suggest that greener living environments and investing in nature and improving the amount of nature and the quality of nature do have positive impacts to health. So that more substantive body of evidence we have, which looks at correlations between the amount of green in the environment and people's health and well-being outcomes, does suggest that the greener environments we live in has a positive influence on physical and mental health. It also has an impact on quality of life and is associated with inequality or less stark inequalities in health and well-being. And this comes about through multiple different pathways, such as being active, having spaces to meet with friends, as well as those ecosystem services. But we also know that those direct investments, or the things that we actually do to the environment, can have a number of impacts on different types of health outcomes and pathways. So at the direct level, we know that some of the investments that people have made and which have been evaluated have been demonstrated to be related to improved mental health, including decreased stress and improved emotional states. We also see improvements in physiological states, including outcomes such as heart rate, and improved quality of life. The studies also suggest that some of the pathways, so behaviours and so on, can also be positively impacted by these investments in nature. So again, we see some types of interventions resulting in increases in physical activity and actions such as greater likelihood to use active transport methods. We also see that investments in nature can affect how people feel about their environment and their perceptions of the environment. And this is very important because that is one of the determinants of whether people use the environment and whether or what they benefit. So some types of investments in nature have been associated with improved perceptions of safety and of the environment itself, and some are associated with increased usage. And then finally, we see that some types of investment in nature have these indirect effects, which mediate some of the sort of health outcomes. So some investments in nature and interventions in parks and so on have been associated with reductions in crime and a number of different antisocial behaviours. My next question is, whose health benefits from investment in nature? And again, sorry to be repetitive, but this is again a very complex question, and how we understand who benefits is determined by how we understand who is exposed to the environment or the change to the environment itself. It relates also to the frequency and the type of exposure to that environment which people have. And both these questions, we're beginning to get a better understanding of how people are exposed to environments, the importance of frequency and so on. We also think the ways in which people use environments is important, but also some of the sort of softer cultural, qualitative elements of the meaning which environments have for people and the historical and socio-cultural context of those environments appear to be quite influential in determining who it is that benefits from a particular environment or environmental intervention. And again, going back to that point about these nested scales of action and nested scales of impact, people benefit in different ways depending on, again, as I said before, about the exposure, frequency of use, and the meanings at these different scales. But we do think from the studies in which we have available that all social groups benefit in different ways, through different pathways, from investment in nature for health. As the WHO report suggested, that this is one of those types of interventions which can have that population effect, because people are influenced by it or exposed to it through a number of different pathways. But we do have a number of studies which are beginning to suggest that some groups, particularly more socioeconomically deprived and disadvantaged populations, appear to disproportionately benefit from some forms of green infrastructure and intervention. And this is the holy grail of public health, finding ways in which we can narrow the gap in health outcomes between different social groups. So just as a little example of how different groups benefit in different ways, a study conducted by colleagues up in Scotland looking at how different types of natural environment resource benefits children's social, emotional and behavioural development, suggested that private gardens, for example, are particularly important for the early development of children, and particularly again for children in low education households. So this is just an example of how different types of resources have different impacts for different socioeconomic groups, different stages in life course, and for different outcomes. I thought I would just give two little examples of robust intervention studies, so studies which looked at the impacts of investments in nature on a number of health outcomes. So South et al.'s 2018 study of urban greening using a very robust cluster randomized trial. So here they looked at the effects of tidying up and greening vacant lots. So this is where a house is missing on a street. You can see in the little tiny pictures in the bottom corner, quite often these vacant lots are quite untidy. They might be quite biodiverse, but they're not looked after. They can be often places where antisocial behaviour takes place, there's litter and so on. So they compared what happened when you looked after those spaces, you tidied them, you took away the rubbish and you sort of gardened them effectively, with communities which didn't receive these interventions. And what they found was that amongst those people who lived in the communities where the interventions happened, so where the lots were tidied up and greened, there was a significant decrease in self-reported feelings of depression and self-reported feelings of worthlessness in comparison to those communities which didn't have those interventions. So that's an example of where an investment in nature resulted in quite positive outcomes. It's not always the case that we detect positive outcomes. So here's an example, again, a very robust study conducted by Catherine Ward-Thompson and colleagues up in Scotland, published last year. And this was an evaluation of Forest Commission Scotland's Woods in and Around Towns programme. And this programme sought to improve the quality and accessibility and extent of woodlands in and around the towns in the central belt of Scotland. Again, another very robust controlled study, so comparing what happens in the communities where you have this intervention with the communities which don't have this intervention. And again, this is an interesting one because they had the physical changes to the environment and they had a whole suite of sort of social components. So as I said before, the evidence tends to suggest that those interventions which make use of both physical and social components are most effective. However, the study suggested, well, they failed to find effect effectively. And actually, one of their primary outcomes, rates of stress in the communities, suggested that the people living in communities which received this intervention, so those communities which had improvements to their woodlands, those communities' stress rates increased. They also found no significant change in health-related quality of life associated with the intervention. They did find some positive association with levels of physical activity and overall physical activity. And the qualitative evidence suggests that people did appreciate the changes. However, I've put this all up to suggest that when we're trying to understand the effects of investments in nature and interventions in nature, it's hugely complex. Understanding who's exposed and who may benefit and when they may benefit is very difficult. Some of these programs have a considerable lag time, that the cultures of use take some years to develop, for instance, and therefore whether people use for them and whether they benefit can be detectable downstream, but not necessarily within the time frame of some of the studies which we conduct. Despite the uncertainty in the evidence base, I think we can still ask the question, is investing in nature cost effective? And here our evidence base shrinks a little bit again. We don't have a huge number of studies which can tell us whether investing in nature is cost effective, or certainly what types of investment are the most cost effective. The studies which we do have tend to be quite positive, and those studies are produced using a number of different methodologies. So late last year, I think it was, a social return on investment methodology was used to try and understand the value of Edinburgh's parks. So here the analysis suggested that for every pound that was invested in Edinburgh's parks, approximately £12 of benefits were delivered. And those benefits were strongly associated with health and well-being. The way in which they did the analysis focused on a number of health, recreational and behavioural outcomes. They also found that there was a variation in the types of parks and how cost effective it was. So a return of £7 for every pound invested for a natural park in comparison to 17 to 1 for large inner city centre parks. And again, that probably reflects, differentials in the amounts of use and the ways in which people use them. A different methodology, this is the WHO's HEAT tool, which again I'll link to if you're interested in it. This produced a value in terms of a resource. So the Welsh Coast Path, they looked at the health benefits of walking and put an economic value of that of around 18.5 million per year using this tool. And although I'm not really talking about sort of programs, so social prescribing, green interventions in natural environments, the branching out programme up in Scotland, run by the Forestry Commission Scotland, suggested that use of environments to promote health was cost effective using the quality of life, the quality approach, which I'll put some information up on if you're interested in that approach. And they found a cost per QALY of about 8,500. NICE, the body which makes decisions on whether healthcare treatments are effective, puts a threshold of 30,000 per QALY. So you can see it's well within that threshold for cost effective. So these are just some examples of whether evidence which has suggested how investments in nature and uses of nature for health can be cost effective. So my final question effectively is how can we take an evidence-based approach to investing in nature for health? What does the evidence tell us about what is effective and what works? And I'm going to base these final few slides on the work that we did for Natural England, DEFRA, MHCLG, PHE and others on understanding the evidence around green infrastructure and health to inform new standards for England. So we were effectively asked a number of questions about green infrastructure and what sort of characteristics it needs to promote health. So one of our questions was how much green does it need to be green to promote health? And here the evidence is still a little unclear on how much green we need in the environment, but we did suggest that greener living environments promote better health. And that comes about through those pathways which I mentioned before. Some are direct, such as promotion of better mental health. Some are pathways such as promotion of physical activity, and some are indirect, such as the ecosystem services. We also suggested that different types, sizes and configurations of parks and green spaces and different types of green infrastructure afford different benefits, and that we should focus on providing this range of different spaces that mix provision of both public accessible and private green infrastructure, so parks as well as domestic gardens and institutional incidental spaces are important, and they each have a different role in promoting health and well-being at different times within our day or different times within our life course, and it's that mixed provision that is probably most beneficial. We were also asked about the characteristics of the space, so are bigger spaces better, for instance? And here, again, the evidence is not really clear on what's going on, but we suggest that the evidence does indicate that different sizes and configurations of green spaces and green infrastructure and so on afford different benefits within a neighbourhood. And it's the provision of that mixed types of spaces which are more likely to promote better health between all the different communities and through different health pathways. We also asked, where does green infrastructure or parks and so on need to be to promote health? And we did suggest that the evidence indicates that parks and green spaces in close proximity to the home and education, workplace and so on are important. They promote use because they're accessible. However, accessibility varies, and this varies of course according to factors such as the urban form. So if you live in a place with very steep streets, that can affect the accessibility of the space. It also varies according to factors such as climate, availability of transport, and to personal factors such as preferences and one's physical capacity to walk, for instance. We also suggest that the perception of proximity appears to be important. So if there's a great big road in between you and the park, it may be, as the crow flies, accessible, but may be quite psychologically inaccessible. We also think that people are selective in the choice of destination, and proximity is not necessarily the primary factor. People choose different spaces for different purposes, and they're willing to travel to different spaces for different reasons. We also suggest that connectivity of different spaces is important. If you want people to use these places, thinking about how different places connect up can be very important. We were asked, what about the quality of environments, of nature and natural environments? Is better quality better for health? And here again, the evidence is a little equivocal, but from across the evidence, we suggest that better quality and well-maintained environments are more likely to be used and more likely to be associated with better health and well-being outcomes. As I said before, the quality of the environment is highly correlated with people's well-being. And we think this relates to the pathways between green infrastructure and health. We do caution, however, that the perception of quality is highly variable between different sociocultural groups and should be considered when we're thinking about different types of investments in nature. And again, mixed provision. So both thinking about improving or providing new spaces alongside social programs is important. Another question we were asked is what's the role of biodiversity in the sort of ecological quality of the space? And here the evidence again is quite equivocal. We don't really understand how biodiversity relates to health. But we know that people value opportunities to experience nature, that people are drawn to particular spaces if there are charismatic species there. However, again, as I said before, the pathways between biodiverse place and health outcomes are still a little unclear. However, we do suggest that maintaining ecosystem services are likely to promote and protect some of those indirect pathways between environments and health. We do caution again that we need to think about the potential risks of provision of spaces or intervening in natural environments. One of the reasons for this is that there's a risk of exacerbating inequalities in health through inappropriate investments in nature. And this can come about through, for instance, providing new spaces or modifying the provision or management of existing green spaces can exacerbate inequalities in health. And this can come about through processes of gentrification or changing how people access or feel that they can access spaces, whether they feel it's for them or not. There's also evidence to suggest that green infrastructure and interventions in green infrastructure can result in ecosystem disbenefits. So this is things like increasing exposure to pollen or exposure to zoonotic disease. So Lyme's disease, for instance, is a zoonotic disease. And these have the potential to harm health and well-being. One of the points we try and make in the document for the Green Infrastructure Standards is what we need to think about is how we go about doing the investment, how we go about making decisions about what investments are effective and are appropriate. We know that different types of investment in nature are likely to be highly contextual. So what's appropriate in one locale may not be appropriate in another. And this is due to differences in both physical infrastructure, but also socio-cultural, demographic context in which the intervention takes place. We know that investment in nature to promote health and well-being is most likely to be successful if you follow some evidence-based principles. And these relate to needing a good understanding of local socio-cultural and economic context, a better understanding of the desires and perceptions local communities are taken into account. If you want to provide effective nature investment for health outcomes, understanding what people want and likely to use is fundamental. We also suggest that people think of these interventions as health interventions, more formal health interventions. And when we're doing those, we think very carefully about the health needs of target populations. And there's no reason we shouldn't think about investment in nature in the same way. So understanding what it is that a target population needs in terms of health promotion and the pathways through which you might achieve that is a really good way to start to think about what investments would be appropriate. We also suggest that linkage should be made with and by and gain from the wider networks of social and health services. So helping GPs and others recognise that these are resources on the doorstep, that link workers for social prescribing are aware of the opportunities in the area will help ensure that the investment which is made in the environment returns, that it is cost effective, that it is used in an effective way. We also suggest that a theoretical understanding of the ways in which the change in the environment, the investment in the environment may influence health is fundamental to identifying effective investment options. There are now a number of tools which we can use to estimate some of the values and changes to health and wellbeing outcomes through different investment options. So one of those tools is one which we've been working on in the University of Exeter with our colleagues at Vivid Economics and Barton Wilmore. It's called Greenkeeper. It's not only about golf courses, but Greenkeeper tool estimates the health and wellbeing values, so wellbeing, physical health, mental health, and so on, and some ecosystem service outcomes for individual green spaces in urban areas. And you can also use the tool to estimate the health gains or losses from different intervention options within particular areas or to specific green spaces. Our colleagues up the road in University of Exeter have also developed the Orval tool and the Nevo tool, both of which can provide estimates of the economic value of recreation with the green spaces and some of the ecosystem services. As I said before, I'll put these links up on the sort of the package of stuff at the end of the talk. But these are just two examples of the types of tools and guidance documents which are out there to help better understand what types of investment in nature might be effective for health outcomes. So in conclusion, I had apologies for just whizzing through this great big body of evidence across a huge range of different elements to this. But where we've got to now is that we have a small, but it is growing body of evidence, which is if, how, and why investing in nature is beneficial for health. And it's beginning to indicate whether certain options are cost effective or not. We suggest that there are some basic principles to investing in nature for health, which the evidence suggests are plausible, and that developing effective investment option demands consideration of need, context, and suitability of the particular context. And we have indicated a number of the tools, which I'll link to, which can be used to help guide decision making around investment in nature for health outcomes. So thank you very much for sitting and listening to the webinar today. As I said, I'm going to put all this stuff up on the blog, along with a load of resources and links and so on. But if you have any questions, we've got a bit of time now to go through questions, which I think Ben is going to curate for us.
Yeah, that's great. Thanks very much, Becca. Lots of interesting stuff there. Hopefully you can all see we've got about 15 minutes or so for some questions. You should be able to see a Q&A button at the bottom of your Zoom screen. So if you go into that, you can type in some questions and I'll be feeding them to Becca. I'll just repeat that the webinars are recorded, and so they'll be made available a later date once we've got it all packaged up, and the slides as well, and the links and so on, so you can follow up anything that you're interested in. And these will be going up on a hub that we're developing as part of our sweep project, and we'll make that sort of available as and when that's all been set up. But for the moment, we'll crack on with a few questions. So first of all, Becca, first question here. So people from lower socioeconomic groups benefit most from the natural environment, and young children benefit from private gardens, but children from low socioeconomic groups are least likely to have a garden. Is there any way around this?
I think, I don't think there's probably a very quick way around this, but we have certainly made that point in the scoping review for the new green infrastructure standards. I think if anybody's interested, there's a tender out on the DEFRA website at the moment about carrying on with that work. But we certainly tried to make the point in that piece of work that mixed provision is very important. So the provision of gardens is a key pathway through which people experience nature, and that planning and other mechanisms should take account of that fact, and that the unequal distribution of green space is affected by factors such as planning and the way in which we design our urban spaces and so on. So I think it's probably it's a downstream pathway that we start to think about now that we recognize the importance of these types of environments for particular groups' health and for reducing inequalities, that's taken account of in planning decisions, design of urban form, provision of spaces around schools or within communal housing and so on, to recognise that those kind of assets can have benefits for health and can affect outcomes such as inequalities in health.
Great, thanks, Becca. Just one quick thing. Somebody's asked, could you go back a slide, because I think that will have the links and things on it just while we're
sorry.
in Q&A. And a few folks have asked about availability of links and so on, so we'll definitely make sure, you know, those are all on the slides when we package those up and make them available to everybody.
Yeah.
So another question here, and you dealt with this a little bit in the talk. But is there much evidence about difference in cultural experiences of green space and how this intersects with the other findings, for example, health and well-being?
Yes, there is evidence. Analysis of the monetary engagement in natural environments, so the big survey done by Natural England, DEFRA and others, does start to pick up differences in usage of environments between different sociocultural and demographic groups. There are groups which are underrepresented users of natural environments. We also have work from qualitative studies, for instance, which look more deeply at the different experiences of different sociocultural groups and ask sort of questions about why they may not be using spaces. Is it, you know, about their desires and motivations for using environments? Do they feel excluded from those environments? Do they have different practices in how they may want to use environments? Do they see them as a different type of resource from other sociocultural groups? So we now have this sort of interdisciplinary body of evidence, which is it's beginning to both explain the differences in use between different demographic groups and the reasons for those differences. And then our body of evidence, which is beginning to look at ways in which we can make environments more welcoming or more accessible for different groups, depending on those types of barriers, or if it's barriers which mean that people aren't using them. Thinking about how we site environments, or the configuration of environments, or the sort of characteristics of individual environments, and how we can shift those to make spaces more welcoming or beneficial for different groups. We have a colleague here in the university, Sarah Bell, who's been looking at people with sight impairment and how different ways of experiencing environments can be used to make those environments more accessible, more user-friendly for different groups of people, and thinking about enabling environments rather than disabling environments. So I think we still have a patchy understanding. It's not systematic or comprehensive, but we're getting a better understanding of how different groups perceive our spaces, the availability of different spaces for different groups, and then how we can go about managing and promoting different spaces for different groups.
Brilliant, thank you. So I'm just kind of going through the questions here in the order that they've popped up. And we may not have enough time to get to everybody's questions, but somebody else has asked, can we email you with individual questions, please? And yeah, we're always open to that. Yeah. Like everybody else, we have big email inboxes, so it might take a little time, but do feel free. You should have our colleague Shanda Bell's email from the registration process, or you can always find us usually on the Exeter University website. But anyway, we'll carry on with the questions as they've come in. Has there been any work to disentangle the social and natural environment factors with regard to health and well-being? So, for example, the added benefit of adding nature into a social program, like maybe comparing a community garden with social activities and supported programs versus an indoor-based social activity?
Small amounts is my understanding. We have little bits of evidence which suggest that the context in which you deliver certain types of health programs matters. And we think that this is one of the pathways, or one of the beneficial pathways, through which interventions such as green gyms and some of the kind of programs you see delivered through green prescribing are quite important, particularly for mental health provision and so on, that it not being institutional, being out in a neutral environment, seems to be a sort of one of what we call an active component of those interventions, one of the sort of the factors which are beneficial to health or confer better health outcomes as a result of taking part. We also think that environments have different affordances. So being active in a woodland, for instance, can have additional benefits for children's motor skill development. So running around in a flat, smooth playground is quite different to running around in a woodland with knotty roots and holes and other things. It affords different opportunities and different chances to develop different skills and so on. But this evidence is pretty limited. I don't think we can say meaningfully at the moment what are really active components of doing a particular type of health intervention in a particular type of environment. I think this is evidence that we're beginning to work on, particularly with a greater interest in social prescribing mechanisms of what works and for whom and in what ways for those different types of interventions and what types of environments are particularly beneficial. But I think we're still at that quite early stage of trying to unpick the role in the environment or understand how we can better use different specific types of environments within particular types of health interventions.
That's great, and I think I'm just going to jump ahead to a related question here, which I think you probably already just answered, but the question is, given how diverse the evidence base and dependent on context and demographic groups and so on, do we know enough about dose to really be making recommendations for social prescribing?
I think we probably don't know enough about dose, and there are questions about whether dose is the right language for this anyway. I think we can go back to precautionary principles as well about being very careful about how we suggest environments are used, because as I said, there are risks to using environments. There are risks to exacerbating health inequalities. There are risks through direct health impacts such as zoonotic disease and so on. But I think when we bring together wider bodies of evidence about active components of interventions, we're beginning to get an idea of what are the sort of contributory components for these types of different interventions. And some of this is best understandings of the available evidence, which will necessarily be revised as we increase our evidence base. But I think we are beginning to get to the stage where there are some sort of evidentiary principles from which we can derive from the evidence base about how we go about designing different types of health promotional activities or different ways in which we invest in nature to promote health. And I think that's probably the stage at which we're at the moment, but we are aware of a number of different programs which are beginning to try and look at the amount of time spent in nature for health, or the types of nature, or the different types of environment, different types of landscape, and the contribution of that kind of factor, through to the different ways in which we use nature to promote health, whether it's just a context and setting, or whether it's an active instrument within health promotion. So I think it's indicative at the moment, but it's developing, and soon hopefully we'll have a better idea of what's going on.
That's great, thanks. So a question here which is very relevant certainly to the overall sweep kind of program of work, which is all about kind of both environmental and social and economic kind of impacts of interventions and programs and policies and so on. And this question is, in urban areas it can be difficult to get people to accept wilder areas as they seem to be seen as being unloved. In one of the papers they turned a wild area into a very pristine lawn, which would not be beneficial for nature. Do you feel this view of perfect lawns is problematic when trying to improve urban areas for both nature and health?
Could you just rephrase that question in? Is it?
I guess the key thing is, with our sort of work for a lot of people, their perception of what is an attractive environment might be a nicely mown sort of monoculture of grass.
Yes.
And is that a problem when we're trying to improve both kind of the natural environment and the health opportunities within urban areas? Yeah,
I mean, obviously, there are conflicts in both what we're trying to achieve environmentally and sort of certainly some of those secondary pathways through ecosystem services, and what people expect of their urban green space, particularly shared spaces such as parks and amenity spaces. And there's been some good work by Helen Hoyle and others looking at how we can understand people's perceptions of sort of rewilding or increasing the biodiversity, particularly of urban green spaces, of how we balance that increasing biodiversity with maintaining people's the spaces which they've known and loved and have learned how to use over many years. And I know from some studies, particularly from Western Europe, that there are ways in which you can present actions to communities to try and articulate why you're doing this, articulate why it might be important both for wildlife but also for themselves, to ameliorate some of the concerns which people have, and there are many and varied and very legitimate concerns, such as greater exposure to ticks and therefore Lyme disease and so on. So I think, yes, naturally there is conflict there, that people have different expectations, and often they feel that these things are being imposed on their environments from above and beyond and so on. But we do now have some evidence of how we can go about doing those investments in nature and changing environments, which bring the community along with you. And I think some of the points we were trying to make about understanding the community's desires for their spaces, how they use their spaces, getting them involved in the co-design of it, and sort of articulating why you're doing it, are some of the pathways or steps that you can take to address some of those concerns. But yes, the evidence does suggest that people quite often feel that these places are imposed on them and they don't want them. And it's a matter of trying to find ways in which we balance that need to improve our environments with the desires of local communities.
Okay, thanks. So we've just got 1 or 2 minutes left, so I'm just going to ask one more question, and apologies to those of you who we haven't got to your question, but this question is around investment, so I thought we'd wrap up with that, since that's what it's pitched around. So what are your thoughts on how opportunities for environment and investment can best be mapped, and how that could be done in practice with planners, public health and others in mind?
It's a really good question, and I think it's something we certainly be thinking about with the social prescribing, is the somewhat unsystematic nature of what's happening. We don't have a good sense of what's going on within particular regions or geographies, or a local or national scale necessarily. And I think it's through coalitions of action that we will most beneficially understand the resources which we have, and therefore the options that we can take. So, for example, we in the university are working with Dorset, with Public Health Dorset, to help them map the green space assets they have within the county, effectively, to look at who has access to different types of environments, and then to bring our evidence base that we've been working on here in the centre to inform the types of actions that they may want to take. And Dorset's an interesting case because they have a kind of model in public health where they are thinking about how they use the shared assets across the county to promote health. So linking up public health with the environment departments, with third sector and so on, and trying to work in that strategic way to recognise pockets of need, to recognise valuable assets, to think about where they need to invest finite resources for greatest need. And I think we're seeing actions both at the national level, so through the natural capital work, which is happening at DEFRA and Treasury and Cabinet Office and other places, through to OS and the production of the green space map, through to these very local actions. And I know that the Future Parks Accelerator, for instance, the funding which has gone to 8 regions in the UK, part of what they're doing is thinking about mapping the assets, thinking about what resources are there and how they can make best use of them. And we're also seeing bodies such as the King's Fund putting out funds in collaboration with the lottery to help third sector and others find space to talk to health bodies such as the NHS about their priorities and how those third sector can respond. And I think that the environment sector would do very well to look at those types of funding, to think about how can we be strategic and how can we respond to and contribute to public health. That there is this recognition that health is determined by these wider set of determinants, and environment is obviously one of those very important factors. But thinking strategically about, once we've recognised that, what do we do with that understanding, and how do we act on it? And I think one of those key things is working in coalition, that we all have a role to play in that, whether it's academics, local authorities, third sector, but also the public in agitating for protection of the environment and adequate policies around planning and so on.
Perfect, thank you. That's a great way to wrap us up. So once again, apologies if we haven't got to your question. Do feel free to drop us an email afterwards, and we'll see what we can do. We haven't got the next webinar set up yet in this series. We're planning to run them about every couple of months, but as soon as we've got a date confirmed for the next one, we'll be putting that round through the usual channels, through our Beyond Greenspace blog, and on our Twitter feeds and everything else. So with that, I'll just thank Becca very much from me and from everybody online, and hopefully we'll see you all again at the next one. Thanks everyone.